directive that a person does not know when he would die. Okay? لا تدري نفس أي وقت تموت. Okay? Person does not know when he's going to die. Okay? So my time of death is not known to him, or for that matter, anyone else. Okay? Based on that, okay, he can say that, I do not want any life support. When the time comes, I'm going to die. Okay? So based on that I don't know when the time is going to come, what place is going to come, saying, what place is going to be killed, died, I don't know. Okay? Based on that, he can say, DNR and DNI. Okay? Do the same apply to Muslims living in the USA or even the Muslims countries? The masla would be the same, okay, for all those countries. But the issue is that the person is brought to you by an ambulance, okay, as you said earlier, and he's already intubated. Okay, they have compressed his chest, have revived him, okay, and now he's there. Okay, what do you do with him? You don't know at this stage any DNR or DNI. Okay. 6 hours later, the proxy comes in, okay, and says that he had these instructions. Do you take it out? No, you don't. Okay. So when the person was living and he conveyed his directives to you, it's okay. The person is unconscious, okay, and someone else is conveying those directives. If you had not put the tube in, yes, okay, but once you have put the tube in, you're going to take it out. Okay. Say there was 1% chance or 5% chance of him being revived and revived completely. Good chance would be there, isn't it? Because a person is brought in the ambulance, okay. The extent of, brain damage, for example, is not known, okay, and you are trying to revive him. The ambulance people revived him. Now he's in the hospital, revived, okay. Only tests will determine what damage has been done, but immediately the family says remove. You can't remove. Okay. You'll have to wait till the brain dead stage comes. Even now comes an issue of American law, okay, and the physician bound by American law. Okay. Am I telling you to oppose the law? No, I'm not telling you to oppose the law. Okay. What I'm telling you that ethically, Islamic ethics dictates otherwise. Okay. A non-Muslim physician can make probably, a judgment regarding that, versus a Muslim physician, But these are the points that, we'll, inshallah, talk much more in detail. All of you have this?
But I just want to say something.
Mm-hmm. Yes.
That Allah loves intelligence.
It does.
Allah loves knowledge.
Absolutely.
And all these sciences are coming from Allah.
Mm-hmm.
We have to
All knowledge comes from Him, yes.
Yes, all knowledge comes from Him. We have to explore all possibilities and never wait for that to come to us. All these medications, all these sciences are to improve our lifestyle, improve our time on earth. If someone is refusing and saying that, oh, I don't want dialysis, I don't want this, I just want to be pain-free, I don't want to say anything bad, but I think he's acting out of ignorance. Because a couple of lectures ago you said life itself is a blessing as long as we live. We have still a moment to do astaghfar. However, if I am in agony or I am going through a lot of other states, can I worship the way I'm supposed to? I can't. If I don't have the capacity paralysis.
Mhm.
Can you give me a couple of days of proper adjustment in my life? I can do all those things. His thing is that he feels by this old time thing that, oh, I don't know, again, I can't go
Mhm.
out here. And we cannot act out of ignorance. A lot of time my patients come to me, they don't brush. What do? I educate them.
Yes.
I put enthusiasm in their
Mhm,
heart.
mhm.
It is these teeth are for your own well-being.
Mhm.
It's not like you just got a cavity, but you have to supervise those
Mhm,
teeth.
mhm.
So, can we accept ignorance?
You see, no, we do not accept ignorance, no doubt about it. We have to educate them. But that decision to brush the teeth would finally be with the patient.
Yes.
What happens is that many times, I'm there, and someone comes for medicine, okay, and you could smell it from his face, his mouth, terrible, okay. It's not only liquor or whatever it is, but it is much more, as if he has never brushed his teeth, okay. Very foul odor, and you must be aware as you work with the teeth all the time. Okay?
Thanks to the mask.
And put the mask. So, it comes to you, but how do you, how can you force something on them? That is the key.
But our job as a practitioner
To
is
educate them. So a physician is going to explain to them, okay, that Mr. So-and-so or Miss So-and-so, okay, this chemotherapy, okay, that you are refusing may not completely cure the cancer. It depends on what stage the cancer is. Okay, maybe it cures. There may be remission. Okay, and you'll be free of cancer for a few years. Okay, and you'll be able to do your things the way you want. Okay, if you don't take, the cancer is going to spread. Okay, would overtake your body. Okay, and it will be much more pain than what you are said. No, I would still prefer, to have morphine or oxycodone or whatever. Okay, and I want to just remain pain-free. That's it. I don't want the treatment. That treatment is, going to take off my hair, for example. I will lose my hair. Okay, I'll lose that. It will disfigure me. Okay? Sometimes it does. Many times it does. Not only sometimes. Many times it does. Particularly, those who are at very high dose of these things. The effects are, disastrous. Okay? So I don't want to do it. Can we force that? The issue was, can we force them to take the medications? No, we cannot force them to take the medications. Whether that job is of the physician or a priest, it's to show these are the issues, okay? These are the possible side effects, okay? And these are what advantages you would get. Okay? The choice ultimately would be the patient's. You would not be able to force that choice.
These days now, a new term is getting very popular called patient-centered care.
Yeah.
In which what happens is you explain to the patient, these are the acceptable options, what you want to do. And coming back to your question, incorporating the patient-centered care, I give you a true example of one of my patients which I had last week actually. It was a relatively young person, like 60-something years old guy, who was bedbound because of one of the neurological deficits. So he would never walk, that's for sure. He's bedbound. And when somebody is bedbound, they are at risk to develop pressure sores.
Yeah, bed sores.
So he used to lie on his lateral side, left or right. So he developed pressure sores on the left side of his head. And he had history of hip replacement in the past, so he had a prosthetic joint. So when I saw him, his wound, his pressure sore was deep enough to the bone, and he was taking taken to the OR where closer look was taken and the bone biopsy was taken. It was found that the infection has involved his bone, and he would need removal of his prosthesis. So these are, removal of the joint is not small surgery. So, the guy was incapacitated. He couldn't talk even. So he was kind of just bedbound, and he could just, sometimes open eye and, give a smile to the family. So the family asked me that even if they do all of that stuff, surgeries and, a few months of IV antibiotic, hospitalization and all that stuff, what would happen after that? So I had to tell them that he would again lie on his back or side, and he would develop either the same ulcer, or the same ulcer wound may not heal, get reinfected. So in saying so, the guy was in a vicious cycle that he would get better, get discharged, come back for the same, may get better, may not get better, get discharged, come back. So it's a cycle. So it sounds like